Are you worried that your rheumatoid arthritis medications might cause cancer? Let's break down the real facts, because fear should not stand in the way of getting the care that you need. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today we're talking about a very common concern I hear from my patients. Do medications used to treat rheumatoid arthritis cause cancer? This is an important topic because if you're living with RA, you're already dealing with pain, stiffness, and inflammation. The last thing you want is to add worry about your medications. Let's separate fact from fear. We'll explore what the research shows, how these medications work, and how to make the best treatment decisions for your health. Let's start with the basics. What is rheumatoid arthritis? Rheumatoid arthritis, or RA, is an autoimmune condition. That means your immune system, which normally protects you from infections, gets confused. It starts attacking your own joints, especially in the hands, wrists, knees, and feet. This leads to inflammation, pain, swelling, and joint damage over time. If RA is left untreated, it can cause serious long-term problems like joint deformities, disability, heart disease, and even a shorter lifespan. That's why treating RA early and effectively is essential, not just for pain relief, but for protecting your future health. RA is not something you can just tough it out or treat with painkillers. You need medications that calm down the immune system and stop it from damaging your joints. These medications are called DMARDs, or disease-modifying anti-rheumatic drugs. They don't just mask symptoms. They actually slow or stop the disease process. Some are traditional, like methotrexate. Others are newer, like biologics or JAK inhibitors. But with these stronger medications, many patients worry about side effects, including the big one, cancer. So let's tackle that head on. Here's the most important point. The risk of cancer from RA medications is generally very low. Let's walk through the main medication types and what the data says. First one is methotrexate. Methotrexate is the most commonly used medication for RA. It's been used for over 40 years. Some people confuse it with chemotherapy, which leads to fear. But at the low doses used for RA, it works as an immune modulator, not as a cancer treatment. So what does the research say? Studies show that methotrexate does not increase your risk of most cancers. There may be a slight increase in lymphoma risk, but it's hard to say if that's due to the drug or the chronic inflammation from RA itself. The bottom line is that methotrexate is generally considered safe from a cancer risk standpoint. Next are biologic medications. Medications like Humira, Enbrel, or Remicade. These are powerful medications that target specific parts of the immune system. They've completely changed the game in RA treatment to the point where they offer such strong relief and help to prevent long-term joint damage that they can legitimately put people's condition into controlled state or into remission. But because they calm down the immune system, there have been concerns that they might increase cancer risk. So what does the data show? Large studies in real-world patient registries tell us that biologic medications do not significantly increase your overall risk of cancer. Some studies suggest a slightly higher risk of non-melanoma skin cancers, so we recommend regular skin checks with your dermatologist if you already have a history of skin cancer. But overall cancer risk, very low, not higher. Next are JAK inhibitors like Xeljanz and Rinvoq. These are somewhat newer medications that work deep inside your immune cells to reduce inflammation. They've become a popular option for people who have not responded well to other treatments. But let's talk about the safety concerns, especially cancer risk. In 2021, a big safety study looked at older adults with rheumatoid arthritis who also had other risk factors, including risk factors for heart disease like high blood pressure, high cholesterol, or a history of smoking. Some of these people were taking JAK inhibitors and others were taking TNF inhibitors, another type of RA medication. Here's what the study found. In that specific group, older adults with some of these heart risk factors, including smoking, those on JAK inhibitors had a slightly higher risk of certain cancers like lung cancer and lymphoma. But in people who don't have those risk factors, meaning they're younger, non-smokers, very key because we know smoking increases the risk of many cancers, and generally healthy, the overall cancer risk associated with JAK inhibitors is still considered low. So what does all this mean for you? If you're in that higher risk group, we'll take that into account when deciding on your treatment. You might be better off with a different medication. But if you're not in that group, JAK inhibitors may still be a safe and effective option, especially if other treatments have not worked. Again, it all comes back to personalized care. Every patient is different, and your treatment should be based on your unique health profile, not just headlines or fear. Here's something most people don't realize. RA itself can increase your risk of cancer, especially lymphoma. Why is that? Because chronic inflammation is harmful. It can lead to changes in the immune system that raise cancer risk over time. So if you're afraid of taking medication, but leave your RA untreated, you may actually raise your cancer risk more by doing nothing. That's why I always say treating RA is not optional. It's essential. The key is using the safest and most effective medications at the right dose with the right monitoring. My practice at Chicago Arthritis, here's how I guide patients through these somewhat difficult decisions. We start with lower risk medications first, like methotrexate or hydroxychloroquine if appropriate. We only step up to biologics or JAK inhibitors if the RA disease is not under control. We tailor the treatment to your risk factors like age, smoking, and other health issues. And we use shared decision making, meaning you're part of the process every step of the way. I also emphasize lifestyle changes as part of RA treatment, including an anti-inflammatory diet, regular low-impact exercise, weight control, reducing stress, and of course, avoiding other bad risk factors like smoking, which not only increases your risk of cancer, but also makes your RA worse as well. Overall, these make the medications work better and may reduce your long-term cancer risk as well. Let's clear up a few common questions. Number one, if methotrexate is used in cancer, as it is, doesn't that mean it's dangerous? Not necessarily. At cancer doses, it's much stronger. For RA, the doses 10 to 100 times smaller and much safer. Another question that I frequently hear, do I have to stay on medication forever? Not always. If your RA is well controlled, we may be able to lower or taper your dose or even stop in some cases. But the goal is to keep your RA disease in remission. As such, the majority of RA patients will be on some treatment long term. Next question is, should I get cancer screening more often? For most patients, you should follow standard screening guidelines, like getting your routine mammograms, colonoscopies, and skin checks as appropriate. If you're at higher risk, for example, let's say you are a smoker or have been a smoker in the past, you may require additional screening, and we may recommend more frequent testing. Another question, what if I just want to try natural options? I support natural options and strategies, but not as the only treatment for RA. Supplements, diet, and lifestyle all are helpful, but they typically do not replace medications that control the immune system. If you have high-risk features, such as active inflammation on ultrasound or MRI, or swollen joints on examination, and high inflammation levels on labs, not utilizing medication is very risky. And your risk of progressive erosive disease, permanently damaging disease, is much higher. In those cases, medication absolutely makes sense and cannot be replaced with non-medication options. So do RA medications cause cancer? For the vast majority of people, the answer is no. The risk is small, and the benefits of controlling your RA far outweigh the risks. Remember, untreated RA carries a higher cancer risk than the medications used to treat it. The key is to work with your physician, your rheumatologist, understand your options, and make the best decisions for your unique situation. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also schedule a consultation with us if you're looking for more personalized care that's focused on safety, results, and your well-being. See you next time, and live well.